If I'm single knee on the right side, I'm going to have my client or patient perform a diagonal motion and a lift and a chop. Do it slow. If you do it slow, you're going to take the prime movers out. The faster you move, the more prime movers you use, and that's going to give you a false sense of the motor control strategies that this particular patient or client is using. Switch, single knee left, draw in 20%, stabilize, and watch to see if there's any accentuation of the lordosis, any postural change. That's what you document. You may see that they have lack of mobility in the thoracic spine or in the hips, and you would also put corrective exercise strategies for that as well. The next station of our core lab sequence is going to be what I've termed to be functional core stretching. And there's 4 functional core stretching movements that I've put together. You'll see that these are quite different than the standard way you would stretch these particular muscle groups. They all have elements of the breath, they all have elements of the draw in, they all have elements of elongating fascia. The first one is supine, drop one leg off, raise opposite arm. As soon as you raise the opposite arm, you're getting an anterior oblique fascial stretch in that diagonal pattern. What are you going to be looking for? Accentuation of the lordosis, tight iliopsoas. So you're going to have your client draw in, not pelvic tilt. You may want to do that to get more elongation for corrective stretch. However, just draw in and set and just elongate and breathe. In through the nose, and then candle core breath. You want to blow out as you purse your lips. And as you purse your lips, you're going to reach and elongate this whole diagonal. Remember, it's that equal and opposite reach that is going to give you that increased mobility. Lengthening in that diagonal pattern. Draw in, inhale through the nose, exhale, elongate. So the elongation is going to be the key. Equal and opposite pressure. That's number 1. Number 2 is going to be a diagonal pattern. Elbow on the inside of the knee, palms together. As I breathe in, I'm going to exhale, rotate up. What I'm going to do with the back of my forearm is going to push against this knee, which activates my adductors, which then allows you to get a diagonal fascial plane force closure type of movement and give you that nice compression in your core. This is a really nice core exercise. You're going to breathe in, exhale. You can do this in weight bearing as well. Next one is going to be a way to elongate the iliotibial band. Typically when we stretch the iliotibial band, we cross our legs and we bend over like this. No upper body movements. We also do movements where we do it against the wall. How about this? Cross the leg, bring your arms up, offset the hands. Offset the hands is going to get more lateral mobility in that lateral line. Nice triangle type of position in a prayer position. Offset hands, left lateral line stretch, in through the nose, side bend away. Always make sure that you draw in about 20% to get a light activation in your deep intrinsics. And then you elongate to be able to get that lateral line mobility. The next one is going to be an elongation of the anterior musculature through what I would call the wall bow. Right hand is going to go up, left hand going to put the palm to the ceiling, and we're going to grab the inside of the ankle, not like this, not like that. It's going to be palm up, inside of ankle. Right arm is going to go straight up the wall, and then you're going to kick back using your gluteus maximus. As you kick back, you're going to lengthen that arm up the wall. As you lengthen that arm up the wall, in through the nose, and then blow out, extend. As you use your gluteus maximus, that's going to cause reciprocal inhibition and release your anterior hip musculature. Again, you're getting a nice diagonal lengthening through that anterior oblique fascial system. Notice how I externally rotated that arm. Again, that's a key component to that latissimus dorsi type of lengthening. So those are 4 nice movements that are more functional core stretching than conventional ways to stretch the muscle groups that we